Coming up today, a beloved high school athletic director faced the toughest opponent of his life. How a cancer diagnosis sparked a student-led movement and a game plan for a comeback. Good morning, I'm Jessica Lovell, and welcome to the Morning Medical Update. We are live from the Dulcie Simons Jr. Family Broadcast Studio at Olathe Hospital. This morning, we are taking a closer look at prostate cancer, breaking down what it is, how it's treated, and the latest advances in care, all through the lens of one man's journey. But first, next month is Stroke Awareness Month, and we are partnering with the K to raise awareness about the signs of stroke and how to get help fast. In today's morning rounds, we welcome vascular neurologist Dr. Joe Wen live from our KCK studio. Dr. Wen, good morning. How are you?
Good. How are you?
Good, thanks. And thanks so much for joining us. As we mentioned, May is Stroke Awareness Month, but we are getting a jump start and telling people about the stroke assessment offered to anyone. They just have to go to our website, and you can find that under the stroke tab. Dr. Wen, let's run through some good basics of stroke awareness. Who is most at risk for having a stroke?
Yeah, so when it comes to stroke, a lot of the kind of the most important thing is a lot of them are preventable. And so those who are at most risk of stroke typically have, the typical risk factors we expect with stroke. So the leading one is high blood pressure, so hypertension, but also high cholesterol, tobacco use, diabetes, and then, kind of lesser known or even heavy drinking, obesity as well can increase your risk of stroke. So it's important to, try to manage these, definitely follow up with your, primary care, because if, your high blood pressure, diabetes and all is well managed, that greatly reduces your risk of stroke.
What are some of the first warning signs if I'm having a stroke or if I'm watching somebody who might be having a stroke?
Yeah, so we have a kind of a great mnemonic we like to use that makes it helpful to remember called Be Fast. And so, most people think of, word finding difficulties or weakness as, the concerning sign for stroke, but there's some lesser known. So kind of that first B is for balance. So if somebody's having difficulty walking, falling over, that can be a sign of stroke. E is for eyes or vision loss. So, whether or not you're unable to see out of one eye, both eyes, can't see on the right or left part of your vision. And then F is for face. So obviously any facial droop. And then A is for any arm or leg weakness, especially with stroke, we expect weakness to be on one side of the body. And then S is for speech, so whether that's slurred speech, if somebody, one of your loved ones is having a hard time getting their words out or understanding what you're saying, all of those are concerning for stroke. And then T is lastly, terrible headache. So any of the above symptoms with a terrible headache can be signs of a brain bleed. And then T also stands for time. And so meaning, the moment you notice any of these symptoms, the first thing you should do is call 911.
Dr. Wen, what would you say are the best health practices to avoid a stroke?
Yeah, and so, of course, following the kind of before mentioned, high blood pressure, managing all your risk factors. But we also recommend, following a good diet, so Mediterranean diet, which typically, includes olive oil, lean meats, trying to avoid a large amount of red meat, and trying to stay with, fish and leaner meats such as that, and then obviously physical activity. We recommend about 75 minutes weekly of either intensive, working out, or at least around 150 minutes of just less intensive exercise.
Dr. Wen, thanks so much for your insight this morning.
Thank you.
Well, for more than 3 decades, Pat Butler has been a constant inside the Olathe School District. He's been a coach, a mentor, leading and shaping young lives. But last year, his role changed when he was diagnosed with metastatic prostate cancer. The one who had been spending years guiding students suddenly found himself on the receiving end of that same support.
It's not really my deal to be the center of attention.
Thank you to Northwest. I spent a lot of time there. It's still very special to me. Obviously, thank you to West.
But they were like, well, we're doing it.
It's hard to tell kids no, and the students at Olathe West High School are no exception.
These are the times that kids just rise to the occasion every time. I mean, I always tell people, like, kids are about the same as they've always been, and they usually want to do good, and they want to please, and they want to be a part of things that are like this, and that's what's happened here.
Meet Athletic Director and Assistant Principal Pat Butler. He's been a popular fixture within the Olathe School District for the past 33 years. But it was his recent prostate cancer diagnosis when he found out just how loved he really is.
I was feeling a little run down, more than normal. Started having some kind of different back pain and some pains in other areas that for a while I just associated to like being old.
Pat thought it might be a urinary tract infection or a hernia.
And then they did the PSA test and it was very quickly obvious what was going on.
Although he said he had a pretty good diet and exercised, Pat admits he hadn't had a physical in a really long time.
You chat GPT stuff and you're like, okay. It was pretty obvious what it was, and then we did some initial scans and they were continuing to show what was quickly becoming obvious, that it was metastasized cancer.
Doctors at the University of Kansas Cancer Center confirmed it.
If I remember right, he said, you know, you've probably had this going on for a year, 2 years, and just kind of live with it. But I do look back now, and I think there were some symptoms that were there that I just was kind of, you just live your life, you know, you're just like kind of crank through it.
Doctors moved quickly and started Pat on 6 rounds of chemotherapy over 18 months, and then put him on hormone blockers. He's responding well so far and will continue to get scans to check his progress.
I so appreciated right off the bat just sort of like this attitude of like, we'll do this, and if this doesn't work, we'll do this. I coached for a long time and it felt very much like game planning. You know, like, this is what we'll do in this situation. If that doesn't work, we'll do this in this situation, and that helped a lot. While
Pat was busy getting better, his students were busy building a brigade, Butler's Brigade.
They kind of capitalized the AD, so you know, the athletic director AD part of my job. And it's a cool design with kind of barbed wire.
And before long, the brigade grew.
We played a basketball game, and the team we were playing, their head coach was a guy who I coached a long time ago. He's now the head coach at Shawnee Mission Northwest, and their whole team and their whole coaching staff rolled in for the game to play us with the shirts on.
Pat was humbled by it all, so much that he wanted to share the experience and the funds raised by the T-shirts with the Cancer Center.
I felt like, well, they're right here. I know tons of people that have gone through the same thing with KU. And so I'm like, well, let's just raise some money and we'll take it over there. And so that's what we've been able to do. I went to Mizzou. So the joke has been, this is like the first time in my life I'm like, let's go KU. But it's only for the Cancer Center. I don't want to go into any KU athletics. That's been a little joke that we've made. It's been fun.
And we promised you that wouldn't happen.
I appreciate it.
We'll keep our word, just the Cancer Center. Pat Butler joins us alongside his medical oncologist, Dr. Blaine Knox, this morning with the University of Kansas Cancer Center. How are you, Dr. Knox?
Doing well. Thanks for having me.
Good to have both of you. Joining us from our KCK studios, urological oncologist, Dr. Will Parker, also at the Cancer Center. How are you?
Doing well. Thanks for having me.
Good to have you. We'll get back with you here in just a moment, but I want to start with Pat. How are you doing today?
I'm great. I'm great.
Good. Feeling good?
Yes.
So you spent your life coaching kids through some of these big, great moments, but you were getting support from students after this diagnosis. What was that like? What did that feel like for you?
Yeah, I mean, I think it was great medicine. You know, I have an amazing boss / really good friend, Jay Novacek, who kind of spearheaded this. I'm not a lover of attention, but they were pretty adamant that they wanted to do this, and it's been amazing. It's an amazing community that has kind of wrapped their arms around me and my family, and then it was able to bring some attention to the issue, raise a little money. We have other folks in our building that have dealt with the same things, and so we were able to kind of bring them along this journey as well. So all of it was just a great positive.
You raised a lot of money, and we're going to talk about that here in just a bit. So very, very cool. Butler's Brigade. Dr. Knox, what exactly does metastatic prostate cancer really mean? Kind of put that in perspective for us.
So when we think of metastatic prostate cancer, we think that this is no longer a localized disease, but has begun to spread to other parts of the body. Most commonly, this is your lymph nodes or to bones, but can involve other organs. So we think of it as a systemic process rather than a localized disease. So we don't think about surgery being able to, effectively remove it. The treatments are with systemic therapies.
Dr. Parker, why is prostate cancer often called the silent disease? What does that mean?
Yeah, so prostate cancer, unfortunately, doesn't cause a lot of symptoms until it has progressed a decent amount. And so for most men with prostate cancer, there are no symptoms, which is why it is silent.
So where does screening come in, and why is that so important?
Well, because it's a silent disease, that's why screening is so incredibly important. Without routine testing, if you're waiting on a sign to tell you that you have a problem, you're likely going to miss the early indications, which can lead to early treatment and better outcomes.
So Pat, looking back, were there symptoms that maybe you wish you would have paid attention to, and what were those?
Yeah, I think throughout the last fall, I was feeling like kind of run down, more tired than normal, had some different kind of body pains, different, back pain, things like that. But, I just kind of chalked it up to aging, and maybe I had hurt myself working out or something like that. And then in the late fall, it reached a point where I was like, yeah, this isn't probably normal, and started heading into the doctor. But looking back, there definitely were some signs that I like a lot of people, just kind of lived my life through and didn't really act on.
Well, what was your routine as far as getting to the doctor and checking PSA and things like that?
Yeah, no, I hadn't had I actually had a physical in August, but I hadn't really had a physical before then in a long, long time. And so, I felt like I lived a pretty healthy lifestyle, but as far as like the routine checkups, I was probably like a lot of men and hadn't done that maybe the way I should have.
Dr. Knox, Pat went through chemotherapy and hormone therapy. How do those treatments work together?
Yeah, so in prostate cancer, we think of testosterone being a fuel for these cancer cells, causing cells to grow, divide, and spread. So the mainstay of treatment is to block that ability. We do that in a couple ways. We lower somebody's testosterone, and then we block the ability of the remaining testosterone to work inside of that cancer cell with 2 different therapies. And this is quite effective, and effective for a long time. That's been the mainstay of treatment. But eventually the cancer cells would become resistant, and at that point we would add in chemotherapy down the road. What was found is if you do chemotherapy up front with all 3 treatments, we call this triple therapy, that you can really debulk the cancer a lot more, and you can kill off these cells that later would have developed resistance. So using them up front, you can really hammer this down as much as possible, and it's clearly been shown to be the best approach.
Dr. Parker, I want to talk about PSA levels as if someone doesn't really know what they are. So educate us about what they are, what they mean when they're elevated, and then what the next steps are when they are elevated.
Absolutely. So first off, you had mentioned screening and where screening fits in. Screening is PSA testing. PSA is a blood test. PSA is actually a normal protein that the prostate makes, so it's not something abnormal. But it is a marker of prostate health. So the PSA levels can elevate in situations where the prostate is unhealthy. One of those conditions can be prostate cancer. And so with PSA testing, we adjust it to age, because age influences what the normal PSA level is. And if it's elevated, then that means that we need to do some additional investigation.
So it doesn't automatically mean cancer. Does it mean risk of cancer?
It does. So it doesn't automatically mean cancer. It does mean risk of cancer or some other condition that's influencing the PSA. So for instance, enlargement of the prostate, lower urinary symptoms, infections, those can also influence the PSA. But it's important to remember that the thing that's most dangerous to miss would be a prostate cancer. And so it really comes down to ensuring that we rule out prostate cancer as the primary cause before we start thinking about those other things as being the culprit.
So Pat, when you heard metastatic prostate cancer, how did your care team kind of help you emotionally through that, and then of course just medically understand what that meant?
Yeah. Dr. Knox was great. A very calm approach to what was kind of a scary diagnosis. And of course, you get things on the app sometimes before you're face to face with the doctor. And so, like anybody, you start immediately looking things up.
Were you Googling?
Yes, absolutely. And I have two grown sons who are both really smart guys, and they were quickly doing the same kind of research. But when we met with Dr. Knox, we had a much more calm approach and a very quick plan to how to attack this. And as I said in the video, that was very reassuring to know that, okay, let's just get to work on this now.
So how does it go from prostate cancer to metastatic prostate cancer?
So eventually, over time, these cancers develop within the prostate, but they can continue to develop additional genetic changes, and these cancers can continue to grow, and eventually it spreads to the kind of edge of the prostate, and then again, we think that there's probably a genetic change within these cells that allow them to start to spread into the lymphatic system, the lymph nodes, and then from there into other organs, again, bones being the most common. So, the symptoms Pat was experiencing of this, back pain and these bone pains, that's a common situation for people because that's one of the first places it will start to spread.
Dr. Parker, what are the newer targeted therapies for prostate cancer?
Yeah, there are a number of targeted therapies, and Dr. Knox also should probably weigh in on this. The primary therapy that we've really evolved to is understanding that some of the genetics in prostate cancer allow us to identify treatments that are directed at a personalized level towards that cancer. So for instance, prostate cancers make a protein on their surface called PSMA, and now we have therapies where we can deliver radiation, for instance, directly to cancer cells based on that expression.
Dr. Knox?
Yeah, actually, and Dr. Parker used a good example there. A specific treatment that does that is called Pluvicto. So when we try to figure out where the prostate cancer is in somebody's body, we use something called a PSMA PET scan, and it tells us where all these tumors are. So this treatment, Pluvicto, turns that PSMA protein basically into a GPS tracker, and the treatment targets that specific cancer cell and then delivers that radiation directly within it while minimizing effects to the rest of somebody's body. Right. So, that type of treatment is called theranostics, and KU is actually building a theranostic center to do treatments like Pluvicto that we already have available, but there are a lot of these treatments that are on the horizon, including on clinical trials, and so that'll give KU access to these trials early on and be able to continue to do these within prostate cancer. Actually, in the last month, we just opened a new trial using the same technology, which is really, really exciting. But outside of that, specific window, there are, targeted pills that can be used if patients have specific DNA changes within their cancer cells. Immunotherapy can occasionally be utilized, but this is where you get into personalized medicine, that it really depends on the makeup of that individual's cancer.
Well, be sure to ask your questions. Use the chat on YouTube or Facebook. That information is there on your screen. Dr. Parker, how do you decide between surgery, radiation, hormone therapy, or chemotherapy in more advanced cases?
Yeah, so I think it's important to recognize all cancers, all conditions are a spectrum disease, so it's not just one size fits all. With prostate cancer specifically, we have a number of features that we can use to understand how aggressive the cancer may be, from the imaging that Dr. Knox already talked about that helps us understand if the cancer is spread, in which case things like chemotherapy and hormone therapy are going to be the primary treatments, versus things like the grade of the cancer, your PSA, in localized disease to determine if something like surgery or radiation is going to be the best approach. And then it really comes down to understanding what does the person, the patient, want from their treatment. What are their goals, and understanding what are they willing to live with as far as a consequence of therapy.
Dr. Knox, what does the next year look like for Pat as far as his follow-ups and future treatment?
So, Pat has gone through the hardest part up front. With that triple therapy approach, we add chemotherapy initially to, really hammer down the cancer to the lowest level possible. So that's, over 18 weeks or just over 4 months. It's the hardest part early on. And then, he's finished that and is entering kind of the recovery where, we want him getting back to largely, essentially a normal life at this point. I think through chemotherapy, Pat exercised more than any patient I've ever had on treatment and would come in and share what he was doing. And I think that will continue, and he'll continue to feel better with it. We'll be monitoring his labs very closely. We'll be getting periodic scans. We'll be doing hormone-based treatment still, but this is going to be on an every 3-month basis versus him coming in every 3 weeks. So fortunately, he's going to be seeing a lot less of me, and that's very exciting.
That's a good thing. How's your pain today? Just how are you feeling? And we talked about how you're feeling, but truly, what does it feel like to be back at work too?
Yeah, I mean, I've worked pretty much through the whole thing. That's been good to keep a routine. But I'm feeling better than I was in the fall for sure. We just did our last round of chemo last week, so still a little bit of coming back from that. But overall, I think I'm feeling better, and there's still some things there that I know we're going to work through. But we feel like, I think from everyone that we're working with, that we're making good progress.
Dr. Parker, what is your message to men who feel healthy and maybe assume that they don't need to get checked out?
Yeah, I would say, remember, prostate cancer is silent. A lot of diseases are silent. Health is about recognizing that routine testing and screening is important. So don't be fooled that feeling good means that all is well. You'd rather find something early and deal with a small insult than wait and have a bigger problem that then you have to address.
Pat, you said you have 2 sons, but you also have a bunch of kids, hundreds of men that you work with, young men that you see at school. Do you find yourself answering questions and talking to them about their health? What are those conversations like?
Yeah, I think some with the students, and then I work with a lot of adults as well, and I have a lot of young coaches and teachers that I work with, and just a lot of colleagues, and they've asked a lot of questions, and so it's good to be able to kind of share your story a little bit, and then encourage folks to, follow the doctor's orders and get those screenings done.
What a great opportunity for you.
Yeah, for sure.
Dr. Knox, when blood work indicates something is going on, what is the next step, and when should patients insist on a follow-up or perhaps a second opinion?
Well, I think right away, as Dr. Parker alluded, I think time to figuring out what's going on is very important. So as soon as something's abnormal, you need to make sure that the team you're working with is taking it very seriously and getting the next steps in terms of diagnostic workup, in terms of procedures to determine exactly what's going on, and then working towards a treatment plan is happening in a timely manner. If it's not, then you definitely need to go somewhere else, and get a second opinion. And then, these are scary diseases and diagnoses that people are going through. And, some people, we have a conversation, or they have a conversation with a provider, and they're just, still a little bit unsettled. And sometimes hearing it again from a different source or from a different, facility is sometimes helpful for people. And so some people just, prefer a second opinion, to reassure, what the next steps are.
Dr. Parker, when is surgery the best option for a patient versus radiation, and how do you have that conversation with patients and help them through that decision?
Yeah, that's a tough question. So the one thing about prostate cancer that's kind of unique is that for most localized stages of prostate cancer, surgery and radiation are equal in the chance of cure. And so as a result, it's not a situation where one is definitively better than the other. It really comes down to quality of life and understanding what are the side effects someone's willing to live with. So a lot of my job is actually trying to understand what motivates people and what are their goals.
Also, sometimes when people are diagnosed with prostate cancer, treatment doesn't happen immediately, and I've heard you talk about this. Sometimes you'll just watch it. Why and when is that the case?
So low-grade prostate cancers, again, prostate cancer being a continuum, it's graded on a scale. Low-grade prostate cancers really have a very low risk of causing mortality, so killing someone. In fact, the lowest grade form of prostate cancer doesn't appear to cause any risk of death from prostate cancer. So for those men, treatment often represents harm. Putting them through something without a anticipated benefit exposes them to risk. And so that's when it's most appropriate to monitor in order to keep men safe from developing a higher grade or more aggressive cancer down the road, but also keep them safe from me, essentially, from doing something that may cause side effects they don't need.
That makes sense. I want to ask Pat about Butler's Brigade. Tell us about how this all came about. Where did this idea spark from?
Yeah. Well, I work with awesome people, and like I said, my principal, Jay Novacek, he and I have worked together for like 30 years, and he was pretty quick to say, we're going to do this, even though I was a little bit hesitant. But when we realized we could do some cool things here and raise some money, and it brought a lot of people together, and I think there were other folks in our building, in our high school building, that had gone through this, that we were able to kind of bring along with this as well. Then I was quick to say yes, and it kind of blew up, and it's led to some other cool things happening in Olathe. There's another Olathe high school that's having a soccer tournament this weekend, and they're raising money for KU Cancer Center. One of the other high schools had a basketball night in February, and I know they were raising money. And so if it brings awareness and we're able to raise some money, it's really a cool thing.
And you said the kids are always up for making T-shirts. You said it's kind of their thing.
We love making T-shirts. That's always that always helps the cause. Yeah.
Yeah, it's like their thing.
Yeah.
So you were able to raise, I'm going to let you do the honors, 10 grand?
Yeah, we mailed in a check for $10,000 this week, and I didn't do it. I mean, when you say you, it was our community, it was the folks that I work with. It just happened. I just happened to be the guy that had this diagnosis, but it was amazing to see how people rallied around us.
Dr. Knox, when you hear, one of your patients raising 10 grand for the Cancer Center, how does that make you feel?
It's really special. It's incredible what's happening here in Olathe with each of these events, and it was ignited by Pat, and he doesn't want to take credit for it, but I do think it's a testament to who you are as a leader and how much these students really respect you, care about you, and feel that you're really an important part of their lives to feel motivated to do this. And then it's like catching fire at this point. So it's really cool, and I think for me, I feel privileged to get to be a part of it.
Dr. Parker, what about you? Do you think you guys can put 10 grand to use at the Cancer Center?
Absolutely.
It's pretty great when patients turn their diagnosis in a way to give back. So you guys could do great work, huh?
Absolutely. This is amazing.
Well, we want to get to some questions from our viewers this morning. David is asking, at what age should men start getting screened for prostate cancer if there's a family history? Dr. Parker, I'll let you take that one.
Yeah, so for men who have a family history or other high-risk features, so that's going to be prostate cancer in a primary relative, so first-degree relative, father, brother, child, breast cancer, pancreatic and ovarian cancers, those men need to start at 40. Additional high-risk men are men of African-American ancestry, and then again, men with strong family histories. Average risk men need to start at 45.
Dr. Knox, Brian writes in, can prostate cancer be prevented, or are there things men can do to lower their risk?
This is tough because unlike cancers like lung cancer, where you think smoking causes a lot of them, there's not really one thing that clearly leads to the development of prostate cancer. A lot of the things that contribute to it are not modifiable: age, family history, genetic risk. So there's not a lot in that way. Now, we do think that healthy lifestyle can certainly help, with exercise, healthy diets, limiting processed foods, or in trying to limit red meat to some degree. I have to have a Z-Man in my life occasionally, so you can have it. But this is from Oklahoma Joe's, if you don't know. But you can have it, but a rare, don't make it the main bulk of your diet. Plant-based or plant emphasis is important in diet as well.
What do you want the big takeaway from this conversation to be this morning, Dr. Knox?
I think early on detection is important. So I think screening is a very important thing for people to do to try to identify something early. So I think that's one important aspect. But people are frankly going to continue to be diagnosed at later stages, and I want them to recognize that there are a lot of effective treatments that can work for years, and there are a lot more treatments that are on the horizon, and that they can live a very good quality of life while they're going through this. And I think that's important, because when people hear stage 4 cancer, including prostate cancer, they don't think that that's the case, and I want to make sure that that's something they're aware of.
Pat, thank you so much for sharing your story.
Sure.
And using your story to help raise money for the Cancer Center and beyond. What do you want the big takeaway from your story to be?
Well, I think, like the doctors have said, obviously, doing the right things as far as early detection and getting the blood tests that you're supposed to get, and doing those doctor's appointments and leading a healthy lifestyle are all really important. The other thing I would say is just that people are really good. I mean, that's what I've learned from this so far, is that overwhelmingly people have been amazing towards me and my family, and we've just been kind of overwhelmed by all of it, and we've been so impressed with KU Cancer Center. I mean, we've just had great care and very quick responses to everything we've needed, so that has been amazing as well.
Well, thank you again, and be well.
Thank you.
Dr. Parker, okay, wrap us up on this Friday. What's the big takeaway?
Be your own advocate. Certainly get your PSA tested. Just remember, not all primary care physicians may offer that, so just remember at 40 or 45, depending on your risk. And then from Dr. Knox, clearly a Z-man is okay, so I'm going to take that one as a takeaway from today.
Okay, that's a great takeaway. I have not had that, so I'm going to take some good advice from Dr. Knox. Okay, that's right by my house, so I got to check that out. I'm going to treat myself to that. All right, thanks to all of our guests. Thanks to our viewers for being here with us today. We will see you back here on Monday. And coming up Monday, it was a way different time back then, and Erin Nisley never thought about the risks of having fun in the sun, but decades later, a devastating diagnosis forced her to see the sun and her health in a very different light.
Subscribe to our morning medical update and open mics with Dr. Stites podcast. Now everywhere podcasts are available.